And I feel horrible for all these women out there that have been denied hormone replacement or told they can't do it because it'll increase their risk for breast cancer or clotting disorder or heart attack. And that's all BS, as we now know. But that's not widely distributed through the conventional medical community. Some are still hanging on to that. Well, it'll cause cancer. You can't do it. No, we know human identical hormones in their proper dosing and proper ratios help prevent cancer of all types. So why now? Better late than never, I guess. Hi, everybody out there in internet land.
Welcome to Skin Deep with Dr. Amy Miller.
I'm Dr. Amy Miller. I'm founder and medical director of St. Louis Skin Solutions here in St. Louis, Missouri. And welcome to our inaugural podcast called Skin Deep. So my marketing manager is making me do this, basically, and made me put this little silly thing on my computer screen.
She's real happy with us. I'm Meaghan. I'm Dr. Miller's CEO. I hang out with her most days. Well, some days. Other days I'm at the other location.
So we'd like to start by talking about our wine selection. So this is the way the girls talked me into even doing this, saying I could have wine with the podcast. So we decided to pick a new wine for each podcast and discuss it.
Correct. Today we have a New Zealand Sauvignon Blanc. It's one of our new faves that we've started drinking. It's the Kirkland brand from Costco. So Costco, if you'd like to sponsor us, we'd be happy to have some more of your Sauvignon Blanc.
And it's not expensive at all. What is $7
$7 a bottle.
I mean, I can't tell the difference between a $50 bottle and a $25 bottle, so it works for me.
Perfect.
You can, but I cannot.
I can absolutely. Sauvignon Blanc's a little different. Reds get us more into the pricier numbers.
And we'll do reds. I'm doing Invisalign right now, so I can't drink red wine because it'll stain my Invisalign. It's very annoying.
We cannot have that happening.
No.
So when we kind of started this, we talked about how are we going to get started on this podcast adventure that our lovely Jessie has decided is a great thing for us to be doing. So we batted around a couple things. We want to talk about how do we get here, who we are, all the things. Dr. Miller said, nah, let's talk about hormones. I said, great. I'm up for hormones.
So some of you know that I love hormones, especially bioidentical hormones, or to be more precise, human identical hormones, because they play such an important role in our overall health. And being recently, 5 years out of menopause, it became very clear to me how important estrogen and progesterone and testosterone were to me when I lost them. I've been doing hormone replacement for quite a long time. In fact, I got board certified by the American Academy of Anti-Aging. I was trying to figure out the year. I think it was 2008, may have been 2009. I can't remember. But I have been involved with hormone replacement since then, mainly experimenting on myself and staff.
It would be me.
How did we start? Was I bragging about my libido?
I do think you were bragging about your libido. You were bragging about how well you were sleeping. And I was complaining about the opposite issues, that I wasn't sleeping and that I have no libido.
Yes.
So that took us down a road to start. We brought in doing labs in our own office. So we draw the blood here in the office. One of our nurse practitioners draws that for us, and we send it out to a place called Access Labs. They take lovely good care of us. And then we get the report right into our very own portal. And it shows us all of the things that we are looking at.
So I suspected when Meaghan said she had no libido and was not sleeping, and what else?
A little bit of weight gain, dry skin, just being
Another
sluggish.
interesting thing, the osteopenia, right?
Yes, the osteopenia. I had 4 breaks in 2 years, 4 broken bones in 2 years.
And what was interesting about that, every time we injected her with Radius, which is a calcium-based filler, the same calcium that's in our bones, it never lasted on her. She sucked it all up and put it in her bones. At least that's my thought. So I had a feeling that she was going to be low. So we drew some labs. Her estradiol level was so low they didn't even bother giving me a number. All they said it was less than 5. So basically nil. Her progesterone barely registered at 0.21 nanograms per milliliter. And testosterone was a whopping 7 nanograms per milliliter.
And what's
or deciliter?
normal? What is a non-menopausal woman? Where should we be looking at those numbers to be?
Well, according to the lab, you're all normal.
But normal's not optimal.
Well, there you go. Bingo. Normal is not optimal. And what's interesting is the way the labs get their normals is they test 10,000 people in that age group. But as you may have noticed throughout time, we seem to be getting less healthy. There's more diabetes, there's more illness, there's more of all of that. So those are the numbers that the labs are using to come up with normal. So according to the labs, having no estrogen at age
54.
is completely normal. Now, we all know that that's not nice. It doesn't feel good.
Nope.
It feels like crap. Excuse my language. But according to labs, that's normal. But that is far from optimal. And when you're optimal, you feel so much better. So many of us are stuck in this slow decline, the circular decline where we have no hormones, so we don't exercise because we don't have any energy, and then we gain weight and we get insulin resistance, and then we can't think anymore because we're not exercising and there's too much sugar on our brain cells, basically. So, with Meaghan's non-existent estradiol level, I knew we had to get that up ASAP. Her free testosterone. So, I don't know if you guys know much about hormones, but we like to measure the free levels of the hormones because the hormones can be bound to something called sex hormone binding globulin, and then they're not accessible to the receptors. So, especially with testosterone, you want to look at that free testosterone levels. And hers barely registered at 0.1 nanograms per deciliter. Okay, so we started on an oral estrogen, oral estradiol. Now, we have to be clear that estrogens are not all the same, and progestins or progesterones are not all the same. There's no such thing as a class effect with these medications. Each individual type of estrogen has a different type of effect. Many women out there right now are on something called Premarin, which is conjugated equine estrogen. That means horse estrogen. So there is some estradiol in there, but there's a whole bunch of other horse estrogens that our bodies do not know what to do with. So if you are on Premarin, it's good. Estradiol helps, but if you can get on actual estradiol, the human identical version, you're going to have a higher safety profile and feel even better. Estradiol does come in a pill form, and you can get it in a topical form. You can get it in pellet form. We started with the pill form with Meaghan, and we also did a pill form of progesterone, micronized progesterone, not progestin. Once again, progestins are a completely different animal than true progesterone. And a lot of people, even docs, even OB-GYNs, don't know that. They consider it all a class effect, and there is no such thing. Progestins are a completely different beast. They are a molecule that's altered by the pharmaceutical company so they can patent it. It doesn't look anything like normal progesterone. The body doesn't know what the heck to do when it starts to break it down. It's been shown to be mild increases in breast cancer for long-term users of progestins. Side note, all birth control pills have progestins, and we wonder why the incidence of breast cancer is going up, especially in younger women. I don't know. So, anyways, I digress there.
It happens.
We started her on micronized progesterone. I don't remember the dose. Was it 100 milligrams?
I think it was 100 milligrams.
Yeah. Okay. A topical testosterone. So testosterone, once again, comes in many forms. It's not great orally. It's better injected or topically or in a pellet form. So we started with the topical form. I wanted to get the dosage right and see how she felt.
I failed at using it.
Yeah. So go ahead and say, so it's been 8 weeks now?
It's been about 8 weeks since we started. 1st of December, I started on the orals and the topical. The orals, super easy. I do the estrogen in the morning, estradiol in the morning, the progesterone in the evening. I'm supposed to do the testosterone suppository in the evening as well. It's a big fat mess, and no thank you. I cannot stay on top of it. So we got new labs and chatted. She's like, why is your testosterone still so low? And I said, because I failed. So we're going to change courses on treatment. But over 8 weeks, I'm sleeping better. I have more energy. The brain fog is starting to lift a little bit.
Okay. All right. So her 8-week lab shows a marked improvement in both her estradiol and her progesterone. Her estradiol is up to 54. Now, that is great considering came from 0, but I want her around 75 to 100. So we're not quite there yet. Closer to the 100 we get her, the better I think the brain fog will really start lifting at that point. And as well with the progesterone, we went from zero point 0.2, now we're at 2.15. I'd like to get her over 3, so we're almost there, but not quite. Progesterone and estrogen work together. You can't have one without the other. There's a bunch of BS about you only need estradiol if you don't have a uterus. That's crap. I can't say it enough. You have to have both together. They work synergistically and they balance each other. Progesterone especially is important for blood pressure. It decreases the smooth muscle buildup around the arterioles, and it helps decrease blood pressure. Anyways, I digress yet again. Her testosterone, however, we were at 7 for her total. We went up to 13. On her free, we stayed at 0.1, so her free did not budge. I think maybe that increase was maybe just within the
Margin of error.
margin of error. Yeah. So not sure if I believe that she even went up a little bit. Did you get any of it in?
Yeah, I did. I mean, I tried, and then I'd stop, and then I'd try again, and then it would just fall on the floor, and it just
Okay. All right.
just too much.
So the options we have at this point are we could try a different type of topical, not a vaginal suppository, but a topical that you rub on the labia, or you could even rub it on non-hair-bearing areas in your forearms or your abdomen or something. We can do injectables, or we can do a pellet form. Pellet is nice because then you don't have to think about it. You just put it in there. It lasts 3 or 4 months, and then you'll know when it's going away. You'll feel the libido kind of coming back down. You'll know it's time to get
Another one.
But I think maybe the pellet might be the best way with you since she is a non-compliant patient. So this way I know she's getting it one way or the other.
Hey, I admitted it. I told you that I wasn't doing it. I was happy to admit
She's
that.
Honest non-compliant patient.
Exactly.
Yeah.
No, it's not that I don't want to be compliant, just that is not a system that is working in my life.
Gotcha. So we'll find a system that works in your life.
Exactly.
And that's part of individualized medicine. We work with you. We find out what works for you and for your lifestyle and what you're going to do and what you're realistically not going to do. Hormone replacement therapy is not a one size fits all by any means. And there's a few national companies out there who train providers to do hormone replacement therapy, and they have a decision-making tree, and if this is this, you do this, and blah, blah, blah. And it's all canned. And that's fine if you don't really know what you're doing. But if you want the best results for your patients, and I have to work with her every day, so we got to have good results, you got to individualize it. There's no one size fits all with hormone replacement.
And that's really the way that we approach all of our patients, all of our customizable consultation plans. They're not just coming in for 18 units of Botox or a half a syringe of lip filler. They're coming in and having a whole plan to take care of them. We want to take care of them.
Right.
And so this is just part of that, taking care of the people that come see us. It's really important to us. It's how come we've been around for 23 years.
Yep, absolutely. So if you're not convinced that hormone replacement is for you just based on feeling better and better health, it helps your skin immensely. Just remember that estradiol, not Premarin, not conjugated equine estrogens, help with heart disease. It helps prevent stroke. It helps prevent osteoporosis. It helps prevent Alzheimer's disease and other memory disorders. It helps prevent vaginal atrophy and urinary incontinence, urinary tract infections, macular degeneration, colon cancer, and cataracts. So how many of those things are what kill women?
Oh,
all of them. Well, maybe not cataracts.
Cataracts are going to kill you,
but yeah, you could go
unpleasant.
blind and be hit by a car or something, I guess. But yes, yes. But estrogen is amazingly helpful for the skin. And just in practice for 20, 25 years, my patients that are on hormone replacement, even if it was the Premarin, had better results with their laser and their treatments. In any aesthetic things we would do, they would have better results than my postmenopausal patients not on estrogen. And I did a little deep dive in how estrogen and the other hormones affect the skin, and it's quite amazing. There are estrogen receptors and testosterone receptors throughout our skin. And in fact, the skin you can consider an endocrine organ because skin cells actually help produce estrogen and produce testosterone. It acts as an endocrine, meaning within the cell, or paracrine, meaning around those cells, the local cells, So it does not, the skin doesn't produce hormones to travel somewhere else in the bloodstream and affect another organ, but it affects things locally within the skin. So it's quite amazing. When you go through menopause, within the first 5 years, you lose 30% of your collagen. And there was a study by a Dr. Brincat, I have it here, back in 1983. So this is how far back this goes. We've known this forever, that if you replace estradiol in postmenopausal women, you have a 48% increase in your
Wow.
collagen. So he did biopsies of women, menopausal women without hormones and postmenopausal women with, and there was a 48%
That's crazy.
increase. Yeah, it's crazy. So we've known for a long time that it's good for your skin. And I look at it from an aesthetic point of view, but from an overall health point of view. If your skin is healthier, you're not going to get those decubitus ulcers when you're in the nursing home. You're not going to get diabetic ulcers, or you'll heal from them much better. So there's a lot of health concerns, not just aesthetic concerns. But of course, I'm all over the aesthetic concerns.
Absolutely. So why now? We dabbled in this quite a while back. We dabbled in doing hormones and things like that. Why this? Why now?
So it's become too important. I got board certified in this in 2008 or 2009. I felt strongly about it then, but that WHI study came out, had scared the bejesus out of everybody. 7 million women were abruptly taken off their hormone replacement. And how many of those women suffered? How many of them died because of that? It was a lousy study. It was funded by the pharmaceutical companies that produced the synthetic hormones and the NIH. I think that tells you a lot right there.
Well, and then they removed that warning in November of 2025, right?
Just
Crazy.
It's about freaking time. So now we can do it with the FDA's blessing. Part of my fear was my license. It's not FDA approved. If I had a problem with the patient, say a patient got breast cancer because she was on birth control pills for 20 years, not because I put her on estradiol for 6 months, but because it was not FDA approved, I would not have a leg to stand on in court. I'd be sued for malpractice. I could lose my license. So finally, it's okay to do. Now, testosterone is still not FDA approved for women. I have been doing testosterone myself for at least the last 10 years. I started pre-menopause because of my bones. I found I was osteopenic and I needed that to strengthen my bones. And it's done nothing but great things for me and for my marriage. And we'll discuss that at a later podcast.
We're going to make him come on.
Yeah, we'll make hubby come on and we'll talk about it. I recently started him on some, so we can talk all about that. Where was I going with that?
About why now?
Oh, why now? Now I can at least do estrogen and not be scared. Not be scared that a competitor is going to report me to the board, which has happened, or that I get sued for malpractice. It's illegal now, quote unquote. But it's always been important, not just because the FDA has decided it was okay a few months ago. It's always been important. And I feel horrible for all these women out there that have been denied hormone replacement or told they can't do it because it'll increase their risk for breast cancer or clotting disorder or heart attack. And that's all BS, as we now know. But that's not widely distributed through the conventional medical community. Some are still hanging on to that. Well, it'll cause cancer. You can't do it. No, we know human identical hormones in their proper dosing and proper ratios help prevent cancer of all types. So why now? Better late than never, I guess.
Well, and I wouldn't say better late than never, Amy. I think that, we often like to we err on the side of caution. We don't want to do something that could hurt a patient. We don't want to do something that could hurt the practice. So oftentimes that's how we drive the decisions. So I think that this is really a great time to bring it in. And I also think that women our age are much more in tune with their bodies. They're not 55 was old 50 years
You're
ago.
written off.
Right? So 55 is now, I don't want to be cliche, but the new 40.
I agree.
We're feeling better. We're more active. We're hiking. We're biking. We're working out. We're doing all the
We're
things
taking care of ourselves.
that women at this age didn't do 2 generations ago.
Right.
And it makes a world of difference in what they want and what we can give to them. And I think with the estrogen and the collagen and all of those things going hand in hand, this is we have the perfect patient population for this to be a really, really good thing for them.
Absolutely. Absolutely. So, if you want to learn more about hormone replacement therapy, give our office a call at
394-3915. We also have a Lunch and Learn coming up, and you can learn all about that on our website and on our social media.
Bye, everybody out there in internet land.